So I just want to follow up to a reel that I just posted on Instagram about evidence-based practice, and had the picture of the stool. So you know the stool, evidence-based practice is the seat. There's 3 legs of the stool that support the stool and make the stool fantastic. So what makes evidence-based practice so fantastic, and what the reason why everybody should do it, the reason why they shove it down your throat in school? Well, the 3 pillars are reading the research, talking to and conferring with other clinicians, and taking your patient's point of view and consideration and feelings and wants and needs into consideration. So when you put all those things together, you come up with a fantastic treatment plan that's based on evidence. So here's what I have to say about that. So the 3 legs of the stool are what I call quackery, fuckery, and jackassery. And here's why. So the leg of the stool that is supposed to be go out and read the research seriously. So that's what I call quackery. All right. So go read research that we know can be manipulated to say whatever you want to say. So I've got a stack of research articles at my office that I use this as a demonstration. A stack of research articles. It's a 3-ring, I think it's a 4-inch or 5-inch 3-ring binder that's full. And every single one of those articles tells you why you should be stretching, passively lengthening a muscle for a specific amount of time. So stretching a muscle, holding it for 10 seconds, 30 seconds, a minute, whatever. Why that's such a fantastic idea. Now, not one of those articles goes into the science behind stretching and what causes you to get increased range of motion from stretching. The reason why you get increased range of motion is because you're causing neuromuscular dysfunction, so the muscle can no longer contract to stop you from taking it too long to put your joints in positions they can't get out of. Who cares about that? Who cares about the important thing? We just want to know that stretching will increase passive range of motion, even though passive range of motion isn't the most important thing out there. And sacrificing neuromuscular function, strength, stability should never be an option. So you can take that and compare that to the stack of research that says, this is what happens when you stretch. This is why it happens, okay? So understand that leg of the stool where you're supposed to review the research. A, do you have time to review the research? Do you have desire to review the research? No, you probably don't. So you listen to people who did review the research, and they reviewed the research on stretching and came to the conclusion, this is a fantastic idea because every single research study that's been done since 1952 will tell you that stretching increases passive range of motion. And shouldn't that be great news for all of us? Okay. Now take that and hold that standard of read the research to cupping and needling and K-tape, which you can find stacks and stacks of research that says it works because they call work is decreases symptoms. Okay. If our goal was to decrease symptoms, we wouldn't have to go to a day of college. All you'd have to do is grab something that felt good and throw it on somebody, which unfortunately is what our profession is all about. So wasting your time reading research and getting to a point where all you're doing is reading about how to control symptoms. Symptoms are never the root cause. They should never be covered up. So you should be not reading the research. You should be thinking, what does this have to do with physiology? Why did passive range of motion occur? So I took a muscle, I stretched it out. If I blow up that muscle in my mind, what's the physiology behind the muscle that caused increased passive range of motion? And and if I read the research that says stretching decreases force output, stretching decreases single leg stance stability, Stretching decreases 1 rep maximum test. Man, why am I not listening? Why am I not giving more weight to what happens on a physiological aspect versus how to control symptoms? Okay. So what I tell people is stop reading research. Stop listening to people that quote research, because you can go find research that says whatever you want. Instead of reading research, go back and review your physiology, which we have known is accepted for centuries and centuries. Why aren't we using that? I'm going to come back to that at the end of this video, because I had a fantastic question on that reel that I'm going to address. Okay, so there's leg 1, quackery. Now we have leg 2, fuckery. What physical therapists, chiropractors, athletic trainers, whoever does on a daily basis. So what we're supposed to do as a new grad or a student is go ask the opinions of those that came before us, the experts that are out in the clinics, the people that are certified in dry needling and certified in sports section, APTA, whatever. All right. So where did those people get their information? Well, they got that information from the school system that you, the new grad, just came out of. So they got the same information that you did, with the same emphasis on passing boards, not the emphasis on becoming a fantastic clinician, getting to your patient's root cause, assessing and treating that, and getting them phenomenal results in one visit. So they came from the same broken system that you came from. If I learned how to drive from somebody who is a shitty driver, or the person who taught the shitty driver how to drive, what's the odds that I become an elite driver? Not very good, okay? So why would I go ask the opinion of somebody that came out of the same broken system that I did, and now on top of that has 5, 10, 15, 20 years of experience utilizing their broken knowledge to further dig themselves into the broken medical model? So me conferring with somebody who doesn't know what they're doing is not going to help me figure out what I'm doing. So that's why leg 2, working with other professionals and asking their opinions and putting your head together to come up with answers, is the fuckery leg of the stool, which is why physical therapists use cupping and needling and K-tape and Graston and ART and whatever crap is out there, okay? Because they got that information from somebody that was as clueless as them, who got their information from somebody who was as clueless as them, who came from the same broken educational model that they came from, which is why they're all totally lost and confused, okay? So now let's get to leg 3. Leg 3 is make sure you take your patient's opinion into it. Are you shitting me? When I take my car, well, I have an electric car now, but when I took my car, I had an engine, a gas car. When I took that to the mechanic, I know jack squat about being a mechanic. But I could read an article in Motor Trend, or I could watch a 10-second clip on some TV show about fixing cars and then think that I'm an expert and walk in and tell my mechanic, hey, I don't have the tools at home to do this, but what I want you to do is I want you to reverse the transmission, and then I want you to lick the spark plugs and put those back in, and then give it a 2-elbow shot to the A-frame, and that's going to fix the problem. Do you think my mechanic would be like, oh God, this guy, I've been a mechanic for 15 years. He just told me everything I never knew. No. Do you think I'm going to go into my mechanic and say that? I'm going to say, no, I know jack squat about this. Here's my car. It's doing X, Y, Z. You tell me what's wrong. You fix it. You give me back the car fixed. Why have we as physical therapists got to the point where a patient comes in and says, my next door neighbor got this cupping thing and said it was fantastic. That's what I need. And we go, oh, holy cow. You know what you're talking about. Thank you for telling me how to do my job, because I went to school for 7 years and I'm clueless. When my patients come in and say, I want this, I say, here's why we're not doing that. We don't even have that in our clinic. If I had a patient that came in and said, I need to be K-taped, cupped, massaged, needled, foam rolled, Graston, whatever, I would say, We don't have that here, and here's why we would never do that to one of our patients. Because I'm a doctor that went to school for 7 years that doesn't let people tell me what to do. I don't let clinicians tell me what to do. I don't let physicians, when referring physicians send me a script and they circle dry needling, cupping, K-tape, and my patient says, why are we not going to do that? I say, because your physician is clueless, and that's not going to help your problem. Your physician doesn't even know what your problem is. How can they tell me how to treat it if they don't even know what it is? And then when I do have patients that come in and they say they did get K-taped and cupped and massaged and whatever, and I say, why did they do that? Did you ask them what the purpose of that was? 50% of the time they say they never explained it, I never asked. The other 50%, they give me some cockamamie story about cupping does this and needling does that. And as I'm working on them, getting to the root cause, and in real time, they understand what I'm doing because I explain what I'm doing and they can see the results immediately. And I say, does that make sense what I just did? Yeah, that makes a lot of sense. I can tell an immediate difference. Okay, now does it make sense that somebody stuck needles in your quads to make your glutes fire or make your abs less tight? Does that make any sense? Nope. Not only does that make any sense, but they never got results, which is why they didn't go back to the person who was using the 3 pillars of evidence-based practice. Okay? So you as a clinician should never, ever, ever do something to a patient treatment-wise that you don't believe in, that you don't understand what is going on, and that you cannot explain on a scientific level. If you cannot explain the physiological aspects and changes that are happening there, why are you using that? Because you can't explain physiology of any of that crap, okay? So that's the third leg of the stool, which is jackassery. So now, and imagine this, the patient that comes in that asks for jackassery, where'd they get that information? Because they heard somebody that went to see a fuckery expert who also used quackery to come up with their thought process. Does that make any sense? No. So here's an excellent question that I had that wraps all this up from somebody on that reel. So anytime somebody asks me a question on Instagram, on the reel, I go look up their profile so I understand what their background is and where they're coming from. So I look this person up and I'm pretty sure it's a layperson with no medical experience. So his fantastic comment or question that he made on the reel was, well, I understand that you're talking about how they should be using science, but if they went to 7 years of college and they're a doctor, didn't they learn science? You would think that they not only learned, but more importantly, learned how to apply science, physiology, anatomy, biomechanics, neurology, all of that stuff, how that actually fits into the clinical medical model with assessment and treatment and patient education. Did you learn that? Did you learn how the neuromuscular junction fits into how or why somebody sprained their ankle, and how if you treat the neuromuscular junction, then it's not in the ligament of the ankle, because the ligament is not the problem. The swollen, painful ligament is the symptom. What you should be figuring out is why that muscle did not fire as the primary stabilizer to keep pressure off of the secondary stabilizer and allowed the ankle to sprain, or the ligament to get sprained. That's what you should be thinking about, but raise your hand if they taught you that in school. Raise your hand if they taught you in school how to assess neuromuscular function. They spend a shit ton of time teaching you how to do manual muscle tests, which do nothing but teach you how to assess how well somebody can compensate for you doing a manual gross maximal muscle assessment, which doesn't assess anything. They should have taught you how to assess individual muscles for neuromuscular function so you can figure out what muscles are actually doing their job at the right time, at the right angle, and which muscles are not able to do their job at the right time, at the right angle, which is causing the injury, which then in turn causes the swelling and the pain and the dysfunction and a loss of range of motion. So you would learn that you should never be treating loss of range of motion, pain, swelling. You should be treating the root cause, which is way over here. So that's the answer to that guy's question. Yes, you learn anatomy, physiology, biomechanics in school. You don't learn how all of those things play together. You don't learn where they fit. You learn special tests, but you don't learn how to assess somebody's function. You learn how to assess symptoms, which is why the only thing that you know how to do is treat symptoms. And when you look at the evidence-based practice people, all they're doing is manipulating symptoms, short-term symptoms, because they miss the entire point of assessing and treating neuromuscular dysfunction, which drives pain, injury, breakdown, all the things that people are coming into your clinic reporting, okay? So if you want to learn how to assess and treat neuromuscular dysfunction and stay away from wasting your time treating symptoms and stay away from wasting your time of evidence-based practice, and when your patients come in and say, I expect this, you in turn say, you're not going to get that because that's not going to help you. What I'm going to do instead is this over here. And if you don't like it after the first visit, you don't have to come back. Guess how many people have not come back after I told them I wouldn't do something that they wanted me to do? Because patients only care about one thing: results. And evidence-based practice has absolutely nothing to do with functional results. So when you're ready to learn how to do that, let me know, DM me, comment down below, hit me up on Instagram, whatever. Find me, I'm not that hard to find, and get in the shift, and in 4 months, you can say screw you to all of the garbage that is attached to evidence-based practice. You can have a real practice, you can be a real expert, you can have financial stability, and meet your financial and career goals by implementing something so easy, so streamlined, so basic, but yet so effective and so different than everybody else is doing. Find me, or you'll just stay stuck in the mess.